Recognized for 5 minutes, Ms. Waters.
Thank you very much, Mr. Chairman. I'm very appreciative for you holding this hearing. I think it's so very important. First, let me say, of course, I'm in Los Angeles County, and we have the Director of Los Angeles County Public Health, Dr. Barbara Ferrer, and she is absolutely wonderful. She works long hours. Not only is she managing that department, but she does public appearances. She does responds to requests from legislators and others on town hall meetings, virtual meetings, on and on and on. And this department works very hard. And I am always amazed that we have so many entities in LA County who are following the advice. I have been tested at least 6 or 7 times for every event, public event that I've gone to. Those entities in LA County have required that you have recent testing. They're taking temperatures, and they're asking for proof of vaccinations. They're following the leadership of Dr. Farr in LA County, and they're doing a good job, but I know they're overworked. And without even talking about funding, it is just absolutely necessary that they have the staffing, that they have the funding that's needed to do the kind of work that they're doing and provide the kind of protection that they're providing. Given that we have our health departments, our public health departments, who are struggling because many of them, not only are they under attack, as has been testified to here today, they are basically dealing with these contradictions that I just don't understand. And I want to ask any and all of our witnesses here today, how do we reconcile that we have so many people who are unvaccinated? As I understand it, we have 70 million eligible Americans who remain unvaccinated. And a recent CDC study found that unvaccinated people are 29 times more likely to be hospitalized with severe coronavirus. More than 97% of recent coronavirus deaths are among the unvaccinated persons. Can you help me to understand how we could have our legislators or anybody else who believes that the unvaccinated personnel should be taking care of people who are very ill and being hospitalized because of the coronavirus? Dr. Resnick, how does this work? Does that make good sense? I mean, how is it we could say that there are workers who should not be mandated to be vaccinated themselves, who are taking care of unvaccinated people who are crowding our hospitals?
So good questions, Congresswoman. I might yield to my physicians to give more specific examples, but I do know that the evidence has shown that vaccine mandates that are crafted well are effective in terms of having us well-staffed and well-protected. And obviously, as we know, vaccination does remain the best way to be protected without experiencing risk of infection.
And so, I don't know if it's proper for me to ask you, having stated what you have stated, that do you believe that mandating vaccinations throughout our society would help to defeat this coronavirus that we're confronted with, this pandemic?
So from a personal standpoint, I feel like it is a complicated question, and oftentimes individual communities have their own needs, but I think a key point of this hearing here is that we need a strong public health infrastructure to start, right? So having better information, being able to start out ahead of the game, knowing what's going on, having testing and information and data could help inform our decisions to then, first of all, get out ahead of it, hopefully, and second of all, be able to make informed decisions that might be appropriate for each individual place. For example, a nursing home is going to be different than a bowling alley, then different than a hospital.
Dr. Roberts, what do you think about that? Should we have more mandates?
Well, thank you for the question, Congresswoman Waters. I would just add that we have had vaccine mandates in our country for many years. It is something common that kids have to be vaccinated to go to school. It is very common that healthcare workers have to be vaccinated against certain infectious diseases. This is not new. Our response to this pandemic is no different than how public health has been working for the last 100 years. I do think we need to educate our public and our healthcare workforce about the vaccine. I've spent lots of time and effort educating our community, educating agencies about the safety and effectiveness of the vaccine. But the final decision is up to the individual. And I think that vaccine mandates, again, have worked in the past. We know the vaccine is safe and effective, and we know that individuals in the front lines, whether you're in public health, healthcare, or working in the front lines as a law enforcement officer, you are at increased risk to being exposed to this virus.
Thank you. I yield back.
Thank you very much. The chair now recognizes Dr.